quarantine sites to ensure compliance with the conditions of quarantine. As usual, we make our usual appeal to our citizens and residents to give these compliant officers your fullest cooperation as they execute their duties to ensure that we remain safe through this trying period. Thank you.
Thank you very much, Superintendent Henry. I now invite Dr. Hazel Laws, our Chief Medical Officer for St. Kitts and Nevis, to give us the Health Emergency Operations Center report.
Thank you, Mr. Williams, and a pleasant good afternoon to everyone. As per usual, it's my task to share with you the Health Emergency Operating Center situation report for today, September the 30th, the last day of September. The world marks 1 million deaths from COVID-19. It's been about 9 months since we've been discussing the SARS-CoV-2 virus or the coronavirus disease, and 9 months after it first appeared, the virus shows little sign of abating. The virus is not through with us yet, said family physician and epidemiologist Kamara Phyllis Jones of Morehouse School of Medicine. The virus has only one job, and that's to replicate itself and to go from person to person, and it doesn't care which person. The public health measures that we have been explaining over these past months, these are the gateway, the vehicle, the pathway to our reopening our country. In St. Kitts and Nevis, we've reported 19 confirmed cases of coronavirus disease so far. 17 of these cases have recovered. We have 2 active cases at present, and they are stable. In the Caribbean region, there has been 220,000 confirmed cases. A little over 128,000 of these have recovered, and the death toll in the Caribbean region continues to be low, and we hope that this trend continues. It's at about 3,900 persons who have died so far. Just to give you an idea as to what's happening in our neighboring territories, in Anguilla, they've reported 3 cases, Montserrat 13, Grenada 24 to date, Dominica reported 25 cases to date, St. Lucia 27, Antigua and Barbuda, they are now up to 101, St. Vincent and the Grenadines 64, Barbados 190, the Turks and Caicos 686, Bahamas 3,900, Trinidad and Tobago is almost at 4,500, and Jamaica is over or almost 6,500 cases of coronavirus disease. In the United States of America, they have reported over 7 million confirmed cases so far, and their death toll have passed the 200,000 mark. They are at 206,000 as we speak. Globally, based on the World Health Organization's dashboard, internationally, there has been 33,249,563 confirmed cases, and today, the death toll globally has passed the 1 million mark. It's at 1,040,000. In St. Kitts and Nevis, we continue testing persons who are suspected of coronavirus disease, we continue testing the nationals who return home. So far, we've tested 2,406 persons. At present, we have 150 persons quarantined in a facility, either government designated or at the Ross University School of Veterinary Medicine dorm. We have 2 persons who are in isolation as we speak. To date, a total of 418 nationals have returned to the Federation, and this is between April the 24th to today, September the 30th. As we mentioned last week, we had the 3rd batch of students returning for the Ross University School of Veterinary Medicine, and at present 124 students are in quarantine in the dorms on campus. Now, I subscribe to The Economist magazine, and we read there that the pandemic, the articles confirm that the pandemic is plunging millions of persons globally back into poverty. Between 1990 and 2019, the number of extremely poor persons, they were estimated to be at about 2 billion. And the article says that the number of persons who are extremely poor fell from 2 billion, or 36% of the world's population, to 630 million, or just at about 8%. Most of these persons reside in sub-Saharan Africa and countries that are driven by conflict. The economic crisis that is caused by this COVID-19 pandemic has exacerbated inequalities internationally. And the researchers from Oxford University reckon that the COVID-19 pandemic could cast 490 million persons in 70 countries back into poverty, reversing almost a decade of gains. For example, relatives in the richer countries, at present, they are not even able to send extra cash back home. In other words, remittances have dropped. The economic crisis is already turning into a food crisis. In other words, the number of persons unable to afford enough food to eat is increasing. Let's talk about schools. The disruption to education will have long-term consequences on our children. The coronavirus disease pandemic is also affecting and impacting healthcare systems across the globe. The harm to healthcare systems will be long-lasting. For example, the outbreaks and the lockdowns have impacted vaccination rates. The researchers tell us that the vaccination coverage has fallen. In St. Kitts and Nevis, on March 25th, our borders were closed. So it's been 6 months since our borders have been closed. 0 tourist arrivals over this period. We've noted a decrease in income, a decrease in government revenue and taxes. Ladies and gentlemen, we must reopen our borders. There must be a careful balance between the public health measures that you hear us speak about daily and the facilitation of economic activity. The aim is to reopen our borders safely with minimum risk of reintroduction of the virus. At present, all the relevant stakeholders, including the Ministry of Health and the various subsectors in the tourism subsector, they are presently developing appropriate protocols. Appropriate protocols are being developed to ensure the safety of our people. We need the cooperation of the general public regarding the adherence to the prevention measures, the wearing of the face mask, the hand hygiene, sanitation, physical distancing, social distancing. Because when we do reopen our borders, we have to adhere to these prevention measures in order to prevent a surge in COVID-19 cases. Ladies and gentlemen, we must prevent a second lockdown. When you look at countries who have gone before us, right, the lockdowns have frozen entire economies. And the second lockdown is usually much longer than the first. For example, Israel is now in a second lockdown. Netanyahu said that it's going to be for a month at least, or even longer. There are other countries that are noting a resurgence in the number of cases. Ontario, Canada, the Netherlands, and some of the countries in Africa. And they are going into a second lockdown. The second lockdown is much longer. And it should be our aim to prevent a second lockdown. We are preparing for the second wave or an increase or a surge in cases. And so the medical team has developed the St. Kitts and Nevis guidelines for the clinical management of moderate to severe COVID-19 disease. What we are thinking is that when we do see that second wave of cases, we may have individuals who would become severely ill or even critically ill. And so we are ready to manage such cases. And so 2 continuous medical education sessions are scheduled for October 7th and 14th, and all medical practitioners within the Federation are invited to attend these sessions. You can attend either in person or virtually. A Zoom link will be distributed for all medical practitioners. At present, there is no known specific cure for COVID-19. So there isn't a medication that has been identified to cure this very contagious illness. And so the mainstay of treatment to date remains supportive therapy, whereby if you are dehydrated, they give you IV fluids. If you have a fever, you are given anti-fever medication. If you are experiencing pain, you are given painkillers. And along with the use of a combination of existing medications found to be helpful so far. And some of these medications include immunosupportive therapy, like supplements, vitamin C, zinc, magnesium, etc. It also includes the use of steroids, corticosteroids. It also involves the use of anti-clot medication, antithrombotic medication, and antibiotics, for example, macrolides. So these are just a few examples of the existing medication found to be useful or helpful so far. There have been questions about the COVID-19 vaccine. Although COVID-19 vaccine candidates have progressed to the advanced stages at exceptional speed, many uncertainties remain. At the recently concluded 58th Directing Council of the Pan American Health Organization that ended yesterday, we were told that at present there are 191 vaccine candidates. Of these, 10 of these vaccine candidates have reached phase 3 clinical evaluation. All right, and so that's hopeful, but then there are still many uncertainties because they have to be fully evaluated and proven to be efficacious and safe before they can be approved for use globally. St. Kitts and Nevis has signed on to the COVAX facility. We've actually signed the commitment agreement for the COVAX facility, which is actually an international or global facility that affords member states the opportunity to be able to access vaccines once they become available. The COVAX facility aims to have 2 billion doses of a safe and efficacious vaccine available globally by the end of 2021. And so, yes, as a federation, we have signed the commitment agreement for this facility. Thank you.
Thank you very much, Dr. Laws. I now invite Mr. Abdias Samuel, the chair of the National COVID-19 Task Force and the National Disaster Coordinator, to give us his presentation. Mr. Samuel.
Thank you, Rasroy, Mr. Williams, and a pleasant good afternoon to all who are joining us via all media, forms of media. My presentation today will be focused on the Compliance Task Force and also some of the factors that would impact or help us to be successful in the reopening of the borders. The emergency powers regulations, as outlined by Superintendent Henry, would have brought to the attention of the general public the amendments or provisions made for the Compliance Task Force. It is very important that we support the Compliance Task Force, as they will endeavor to enforce the regulations regarding all the social and physical distancing protocols, or the protocols in general for the COVID-19 pandemic or virus. Now, the compliance process. What is the compliance process for the compliance team? Well, the compliance team will be given their operations. So normally they come, they gather together, they brief, they are given their operations. They go through the compliance checklist that needs to be done. And from there, they are deployed to the various strategic areas that they are asked to check. And then from there, they carry out the enforcement. And these enforcements are done through inspections. And we are appealing to the general public not to obstruct the compliance task force members or officers, from doing their job. It's against the law. Some of the reports that we have gotten where persons are not allowing them to enter into the business place or enterprise. Persons are basically being verbally abusive, and I am hopeful that we don't reach the stage where persons are going to be physically abusive. The reason for these compliance teams is to help us to prepare and also help us to sustain ourselves during this pandemic. We have been saying that we want to be resilient against the impact of this pandemic, and Dr. Laws was quite clear that we do not want to go into no second shutdown. That has been part of our goal going forward, of not going into no further lockdowns, because this would impact us severely economically and also socially and mentally. The business compliance assessment that has been done for the past week has shown a satisfactory or good compliance percentage being demonstrated by the business sector and enterprises. Distance markers on the inside and the outside, the enforcement of mask wearing, the sanitization of highly touched areas such as doorknobs, proper hand hygiene practices, availability of hand sanitizers, and also the availability of hand soap and water. Now, one of the things, again, reports we are receiving that persons are probably diluting the alcohol base that should be 70%, so much so that it feels that there is more water than the actual alcohol that will kill the virus. If in doubt, please contact the St. Kitts Nevis Bureau of Standards, and they will guide you as to the proper mixture for these substances. As Dr. Laws was emphatic earlier in speaking to the reopening of our borders, and we have been saying this and preparing you over many presentations, over many weeks of doing these briefings. We have to open our borders, and it's going to require three things that I am going to highlight. There are many other things, but I just want to highlight these three things. One, there has to be a cultural change in order for us to slow down the spread of this virus and keep it at bay. The cultural change comes from the changing of behaviors and attitudes towards this new norm. What does that mean? For example, wearing of the mask. Why not wear a mask? Persons don't want to wear a mask going into a business place, even though the business place is requiring for you to wear the mask. Upon entering the business place, business owners are complaining that individuals want to become physical with them, and that is not good. Some business owners are reporting that persons become verbally abusive to them and basically tells them, listen, you have to serve me whether you like it or not, and I am not putting on any mask. And we are making this appeal to the general public as one of our main partners in this fight. Over and over, we keep saying it's all of society approach, and you, the general public, have been one of the key critical partners in the all of society approach in helping us gain the successes that we have gained in St. Kitts and Nevis. I am appealing to those individuals who are carrying out these activities and exercises in being verbally or physically abusive to the business sector to cease and desist from doing so. We want to welcome everyone into our country, in particular visitors, to help us generate that economic activity that we so need in order to maintain the competitive nature of our people, competitive nature of our country, and also to generate that economic activity so that we don't become the statistics of being plunged into any further poverty. The next item I want to speak about is the infrastructure enhancement that is going on at our ports of entry. And I am appealing to all partners, in particular in the private sector, to come on board and support the efforts of the government in putting the necessary infrastructures in place in order to safeguard our frontline workers, such as customs, immigration, port security, port health officers, even those ambassadors that will be guiding persons through the corridor of process to enter into our borders. And I am appealing to all to support these efforts. This takes millions of dollars to do, thousands of dollars to do. You heard Dr. Laws would have said that many countries, in particular we in St. Kitts and Nevis, have not had one tourist enter into our borders for the past 6 months. The taxes collected, the revenue on taxes has decreased significantly. So we need an all-of-society approach in the investment of opening our borders. And I want to highlight here that many persons are saying, open up the borders, open up the borders. I am appealing to those persons that when the border opens and we become challenged, please extend the hand of support if you need to see the borders open. And also extend it now. Help us to prepare for the borders. We cannot be saying open the borders, and if you have technical expertise, you are not providing any support, whether it be monetary contributions or just a bare recommendation. And we have been appealing to our private partners, help us with solutions in terms of giving us guidance, giving us recommendations. That's all we are asking for sometimes. However, all that happens at times is persons are identifying what is not being done by the government, what the government should be doing. However, there is no contribution, which is critical, very critical if we need to open our borders. I also want to highlight the next point in this opening our borders is the adjustment that is required in the tourism sector by those service providers. For example, restaurants and hotels. We see that some of the marquee hotels in the Federation have been doing some adjustment to protect their staff and also the potential tourists that may come to their hotels. And we are encouraging persons to make the necessary adjustments. It's quite important to do so to remain resilient. Restaurants, are you adapting to the new norm? For example, if a tourist comes to your restaurant, how would you serve them? Would you have areas for them to go and sit down? These are some of the things that we are asking you to plan out. Make structures within your establishment so that you can be resilient if the virus has to return to St. Kitts and Nevis, and it's very critical. Let's look at also touristical sites or tourism attraction areas. How much investment are some of these attraction areas putting into their establishment to ensure that they could be certified as COVID resilient or COVID free, so to speak, institutions? Is very critical. And the transportation, we have been appealing to taxi operators, tour operators, ferries, to do the necessary to make some adjustments to their vehicles. And some individuals have been doing so, and they have been benefiting from the reward of doing so. And also others are saying that they will not do so. And if you do not do some of these adjustments, then how can we have an all-of-society approach to ensure that we protect and safeguard the general public in St. Kitts and Nevis? This is critical, it's very important, and we are doing our best to put all the infrastructure in place to support you, whether it be through the legal framework, whether it be physical structure, or whether it be the human resource necessary, such as the compliance team and the training of police officers to support the compliance team to carry out these enforcements. These are three critical things that I wanted to bring to the attention of the general public. In looking further to economic development, we have been engaging with the yachting community in looking at the possibility of that particular sector also becoming functional. And it's critical that we look at a multi-sectorial approach to the development of our economic activities. And I want to take this opportunity to commend the yachting community for being proactive and assisting us in looking at protocols, not developing, but looking at protocols in which they can function safely during this critical time of a pandemic. I want to switch to the weather. We were experiencing this morning some very noisy thunderstorm and also lightning and some moderate to heavy showers at time. And an appeal was made to the general public to exercise the necessary caution in traversing through roadways, byways. And I am thankful that besides the one accident that was reported today, we didn't have any more such accidents. And I am appealing to individuals that when we have a little rain, please listen for the advisories that will be issued. This morning I would have received many calls about what persons asking if today would have been a work day, if schools would have been closed, etc. Let us be mindful that we live in a tropical area, so to speak. Our geographical location around this time causes us to be susceptible to rain and tropical waves, etc. A little bit of rain doesn't mean that school is going to close down or workplace should be closed down. I'm appealing to the general public to please be cautious with these activities. And that's the weather for you. Tomorrow we should expect basic cloudy day. Might experience some thunderstorms as there is a system in the Caribbean Sea which at the present moment poses no threat to the islands. So thank you very much, to St. Kitts and Nevis. Thank you very much for listening, and we do look forward for your questions.
Thank you very much, Mr. Samuel. That brings us to the question and answer segment. And the first question has to do with church. Why is it church services are 90 minutes while some private parties are given permission for 3 to 5 hours? Who will take that one? Mr. Samuel.
Thank you for that question, Mr. Williams. We are going to be in further discussions with the Christian Council and the Evangelical Association in terms of reviewing the protocols that have been existing for the churches. However, at this time, I may wish to make a plea to all that there shouldn't be no comparison. I've said it before to the Council and the Evangelical Association between churches and activities such as parties, etc. The church is a sacred place, and we will do our best to facilitate the church as much as we can through the protocols. So we will be engaging with them very soon to do a review of protocols. That's my answer, Mr. Williams.
Thank you, Mr. Samuel. This next question comes from a concerned citizen. When the borders would have been opened, what are the plans for quarantine if we have an influx of persons arriving? Dr. Laws.
Okay, Cabinet has to determine the date when the borders will be opened, and I am thinking that shortly thereafter, the protocols that will be in vogue in terms of the duration of quarantine for inbound travelers, that will be announced and clearly explained to the general population.
Another concerned citizen, this has to do with the cost of the quarantine, the prearranged quarantine, which is $20 by 14 days by 24 hours, which adds up to $6,720. And the person is saying, is there a waiver for persons who would have had a medical emergency? These emergencies are expensive. Adding the quarantine bill for a senior is hard.
Yes, Mr. Williams, again, thank you for the question. And let me just state for clarity, for the purpose of clarity, that the pre-approved quarantine facility request is a special arrangement, and special arrangement is having security 24/7 at that facility. Now, if you want the special arrangement, it's going to come with that particular cost. However, there are other options for persons who may have had that medical situation. For example, if you go to the quarantine site at OTI or Royal St. Kitts, there is a consideration by the government whereby you can make an application in writing to the government to be exempted from the cost of accommodation. However, if your situation is so dire that your medical attention may require further medical attention on arrival, then precedence has been set whereby the CMO will take a look at the application made to enter the Federation and may consider putting you in a medical facility to go through the quarantine period in the event that you may require further medical attention. So therefore, let us be fair that special circumstances will come with special arrangements.
Okay. That there is another question with respect to children, and why is it that children can play with no social distancing but have to be distanced in the classroom? Dr. Laws, will you?
All right, so Mr. Williams, I'm making sure I got the question right. So why is it that children can play without physical distancing but have to be distanced in the classroom? Okay, so we are making an assumption that the children are obviously playing on the outside in the ambient, open atmosphere, and it's hard to really maintain physical distancing amongst children, and that's even more so at the younger age groups. Yeah, and so if the children are playing outside, running around in the open air, just the fact that they are not enclosed, they're not in an enclosed space, that provides them some level of protection. However, in the classroom setting, whereby it's smaller, it's enclosed, we're not sure if the windows are closed or open, it's important for there to be a minimum of at least 3.3 feet between the students. That's the recommendation. Again, ladies and gentlemen, these are recommendations to help to reduce the risk of spread of the virus from one individual to the next. And we have to wait, yeah? A child needs playtime for their own natural and normal development. And so that can be allowed in the open air, yeah, because they're not going to be together all the while. They'll be running around, etc. Yeah, but then once in the classroom, it's a smaller space, it's enclosed. It's important, and it's very helpful to maintain that physical space of at least 3.3 feet between each desk, each student, just to reduce the risk of spread of the virus from one to another. Yeah?
I know we get a lot of opinions on the mask wearing and social distancing. For example, looking at the presidential debate last night, the president normally has a lot of people at his rallies and so on, and they are not wearing masks. And his explanation was, well, they're out in the open, but there's no physical distancing. So, that brings us to the end of the question and answer segment for today. There was one other question people are asking: when will the borders be open? Is there a date? I was informed that there is no date, although there was a month that was suggested. No date has been given yet for the opening of the borders. That will be announced in time. So that is the answer to that question. Thank you very much for your questions, and I hope that they were answered. This brings us to the end of our weekly briefing, COVID-19 weekly briefing for today. I want to say thank you much to Mrs. Christmas Jacobs for her continued service of sign language, to Superintendent Cromwell Henry, Chief Medical Officer Dr. Hazel Laws, Mr. Abdia Samuel, Chair of the COVID-19 National Task Force and our National Disaster Coordinator, Dr. Cameron Wilkinson, Medical Chief of Staff, and to all the media for partnering with us with these weekly briefings. Thank you to all of you for joining us, and we'll see you next week, Wednesday, for another weekly briefing. Take care.
on.